Well, the United States is scheduled to withdraw from the World Health Organization today following President Donald Trump's return to the White House for the second term. The move marks a renewed shift away from multilateral institutions after Washington also halted funding to several UN agencies and announced plans to exit the Paris Climate Agreement. The US had previously left the WHO in 2020 amid tensions over the COVID-19 pandemic before rejoining under President Joe Biden. Now, with the US being one of the World Health Organization's largest contributors, its withdrawal raises serious questions about the future of global health governance and international cooperation. I'm now joined by Professor Tansri Dr. JEMILAH Mahmood, Executive Director of the Sunway Center for Planetary Health at Sunway University. She also joins us from Davos at this point of time. Thank you, Tansri, for taking our call and, of course, for weighing in on this issue. When a major power like the US steps away from the World Health Organization, what becomes harder for the world to manage, especially during things like pandemics and humanitarian crises?
Thank you very much. I think the first thing we have to know is that in the management of either a humanitarian crisis or a pandemic, we have the pre-crisis and then the crisis itself and post-crisis. Now, where the US has really invested in is a lot of the early warning systems, and I think this is going to be affected by the withdrawal of the US from WHO and other international organizations as well. The other thing, of course, is that we like to have free access to knowledge and information and also collaboration. And coordination is quite key, whether at regional level or global level, when a crisis hit. And that requires speed and health emergencies. If you look back at the pandemic, the recent COVID pandemic, where we didn't really do so well globally, but those were when the stakes were far less high than they are today. So imagine if you withdraw the funding, we would really jeopardize some of that early response coordination and so forth. And I think the other thing that the WHO is very, very critical is actually the ability to mobilize resources and experts. And this obviously will be very badly affected by funding cuts, whether it's from the US or anywhere else. And that coherent, well-coordinated and well-funded health responses in fragile conflicts and settings and disasters are also going to be very much affected as well. Already, the UN W.H.O has already said that you will not be able to meet the needs of all people in humanitarian crisis. And imagine having to pick who you are going to be able to, help. So really, it's about delays. It's about preventing disease, reducing mortality. All this will be impacted by the cuts. Right. But the bigger question, of course, is that, why aren't others stepping up, right? I think that, when a major donor like WHO withdraws, I think, we don't want them to withdraw the way they have withdrawn. It's too acute, too sudden, and too much all at once. But I think
when we
now
talk about the funds being cut back in terms of funding cuts, in other words, in real life, which services will get hit first? I know all are impacted, but then there are many areas to look at. There's vaccines, maternal care, there's also the outbreak response. WHO has also warned that we could see a rise in child deaths again. Is this of any concern within the WHO or what's being spoken about there at Davos?
Well, of course, this is going to be extremely difficult to manage because it's people who are going to be affected. It's the most vulnerable people, the ones who are the poorest, the ones who have the least resources, the elderly, children, women, people who are disabled. These are the people who will be really, really affected, right? Those in conflict and in crisis. And when there's no money left, people leave the sector as well, in terms of WHO and other multilateral organizations, and they go elsewhere. And when the money comes back, they don't flock back to return. So you're going to lose capacity and expertise, which is hard to build and will take years for us to recover. And all health services are essential, so funding cuts affect the entire health system. And if prioritized, the greatest impact will comes from reduced outbreak detection and early response capacity. And I think that early warning and early response is going to be critical for us to not get. The other thing we have to remember is that, things like we don't think about, like cold chains for vaccines, logistics, and moving goods around. These are all also going to be affected. And the most damaging, of course, is the erosion or cessation of primary healthcare, basic healthcare that is required in all circumstances, whether crisis or not. And I think this is where, I think we've got to remember that at the end of the day, it is about people.
Right. You warned us a few years ago that the world is facing an ecosystem imbalance, that health crisis, climate stress and inequality are all connected. And we're seeing that now come through more than ever. In a recent speech, the Canadian Prime Minister Mark Carney said that there must be middle ground. What were your thoughts when you heard him talk about this pragmatic pathway for countries to be reactive, or rather to come together and to act together rather than just be reactive?
I think all of us who listened to Mark Carney were so glad that a global leader stepped up and said what he said. I think in the spirit of dialogue, which is a theme of the World Economic Forum this year, I think it's so important that we hear leaders saying that we are facing a rupture. I think this is what Mark Carney very clearly pointed out, where global order has already been disrupted, and what he's calling for is really for not just the superpowers, but everyone else to step up, and that includes Malaysia. We are an undeveloped country. And I think we all need to collaborate better, work out a better strategy in how we can actually reduce the impact globally, whether it's from the climate crisis, the loss of biodiversity, the whole triple planetary crisis, health crisis that are looming ahead. I mean, I've said this many times before, the next pandemic is not a question of if, it's a question of when. And definitely, scientists around the world are saying it won't take another 100 years. So I think Mark Carney has shown real leadership, and I think all leaders should now step up.
What's one issue that's dominating the conversations there, and why should ordinary people around the world begin to care? Because the other point is, beyond any country, what can the international community be doing at this point to keep global health cooperation strong and protected from any one country's politics? The theme this year, Spirit of Dialogue, has really been at the center of discussion. So what's been really discussed here and getting a lot of attention is the geopolitical disruption. And the Global Risk Report of the World Economic Forum has clearly pointed out that conflict, global disruption in geopolitics, whether it's an economic front or even peace, is really going to affect all of us. But also the rise of misinformation and disinformation. I think this has also been prominent. And of course, without doubt, the challenges of climate change and environmental degradation. So what has been happening here, interestingly, is I've been in discussions where you have billionaires, talking very frankly about, their role in, contributing to this. And I think that whole call for greater taxation of the extremely wealthy, fair and equal distribution of wealth, really looking at, how it won't be well if our neighbors aren't well. So it's really about global issues are important as much as regional and national issues. Samsuri, thank you for your time, and here's wishing you, a few more successful days in terms of conversations and dialogues at the World Economic Forum. We'll speak to you soon.
Thank you.
Well, that was Dr. JEMILAH Mahmood, Executive Director of the Sunway Center for Planetary Health at Sunway University. We take a quick break and I'll return with more global updates in just a quick bit. You're watching The World on Bernama TV.